There you go. Okay. So we talked about the pandemic. We talked about remote monitoring and how taxing that was. Um, what do you think about CRA burnout? Is that like a real thing? Do you think you felt some burnout over the course of the pandemic?
I don't really know if I felt burnt out over the pandemic because like I said, I did have that long period of just not being billable. So it wasn't really hard on me.
Yeah.
But I will say, being it's a metric driven industry, especially on the CRO end, and I guess you would have to let me know about the sponsor side, but I think that it's very easy for people to just get into like a mundane routine where they're on one or two studies. It's just the same thing every single visit. They're doing SDV, drug accountability, um, maybe retraining a site or two here and there. And it just becomes like just almost too routine. And I think like when they're trying to, achieve their 8 days on site metrics and especially travel during the pandemic, I will say it's not as like delightful. It's not as
That's a fact.
yeah, it's not as fun as it used to be. It's like kind of dreary. Like wearing a mask the whole flight sucks. You're like steaming your face and like
True.
can't breathe well. It's just, and then they're also not serving drinks if you're not in first class.
True.
Drinks and food. Well, I guess they give you pretzels and like soda and water if you're in, the coach or whatever.
True.
So I see myself being a little burnt out in that capacity, but I still really like what I do. I still like the routine, and I like the interaction, being on site and seeing new places still. I still like it a lot, but I definitely can see people who aren't cut out for routines getting very burnt out.
Yeah.
Yeah.
I noticed I started feeling really burnt out with the remote monitoring during the pandemic because, like you were saying, all the action items, all of the documentation went up, probably doubled.
Yeah.
Because on site, you don't, if you did something, you don't have to document it, but everything had to be documented through email or a note to file or some extra thing.
Notes and files. Oh my gosh.
I couldn't stand it. I was starting to get burnt out a little bit because we signed up to be field CRAs, not in-house CRAs. So it
Yep.
was really like going back to being an in-house CRA.
Yeah.
Not that anything's wrong with that, but that's just not what we came here to do. So,
Exactly. Exactly.
but yes, things are starting to open up for sure now. And actually, I'm kind of a little bit of a lull right now because I closed down most of my sites for my one study, but the other study I'm supposed to be working on right now hasn't really fired up yet
Hmm.
to where it should be. And so I'm kind of in a lull right now. It's actually kind of nice. Uh, I can kind of chill out more so.
Yeah, that is nice, man. You get a little downtime to recoup and reset. I always
Reset.
look forward to when I roll off a study and onboard into another one. I don't look forward to like having to relearn or learn a new protocol and learn all the new like study features and everything. But it's nice when you have that like training period to like reboot. You might get like 2 weeks off from your routine.
Yep.
You can restart. So that is always nice. I think also that's a good point that you bring me to. Like if you're on a really long running study, that can also get you burnt out because like I said, it just does become so mundane and you're just not you kind of like I wouldn't say mastered the protocol, but you just seen almost everything pretty much, and you're just like, this is boring now.
Yep.
So it is nice when you get to cycle through things. You're more likely to get put on a really difficult or maybe not the best study, but I do like a little change every now and then.